This is Willis, a healthy youth from Siaya County living with HIV. Siaya County has an HIV prevalence rate of 14.1%, which is much higher than the national average. Although the country successfully reduced new HIV infections among adolescents by 84% from 2015 to 2021, recent data shows a worrying 13.2% increase in new infections. This trend is concerning given the progress made in previous years.
Siaya County is among the counties with the highest burden of HIV in the region. Currently, the HIV prevalence stands at 13.3%. 40% of the new infections is among the adolescents and the young women. These are between the ages of 10 to 24.
Adolescents living with HIV may struggle to stick to their treatment plan due to stigma. Educating people reduces stigma and emphasizes the importance of treatment adherence, helping to keep adolescents living with HIV healthy and reducing the spread of the virus.
I was identified HIV positive because of this severe sickness. It was a difficult moment for me to accept. I passed through stigma and discrimination in the community level. And I can say that even in school, teachers that were thereby counting for me days that I want to be available to be surviving. I'm one of the adolescent mwenye niko capable ya kutafuta my fellow adolescents in case of amefail kukuja hospitali. I do home visits, naenda na confirm pill counts na hesabu madawa. Naangalia like the adolescents is taking the drug in a good way to make sure like adolescents have suppressed virally.
Women living with HIV can give birth to HIV-negative babies, but this remains a significant challenge in rural communities like those in Siaya and Migori counties. The key issue is a lack of awareness and education about the importance of adhering to antiretroviral therapy, ART, during pregnancy. Without proper adherence to treatment, the risk of mother-to-child transmission, PMTCT, of HIV increases significantly. In these regions, factors such as stigma, fear, cultural practices, and limited healthcare access can make it difficult for women to consistently follow the necessary treatment protocols to prevent transmission to their unborn children. Caroline, a mother living positively with HIV-negative babies, has taken it upon herself to reach expectant and lactating mothers in her village.
I knew my status in 2010. I've given birth 2015, 2020. The two are negative. So that's what has made me to become an expert mother. In a month, I have around 15 support groups with the 12 expert mothers. We do three things. We meet these mothers through one-on-one, through support group meeting, and through outreaches.
Our approach in Siaya and Migori counties is by supporting community adolescent treatment supporters and expert mothers to reach out to adolescents, girls, and women living with HIV. They educate them about health-seeking behaviors, importance of adherence to treatment. They also trace treatment defaulters as well as scale up HIV testing in the communities. Poor health-seeking behavior, poor knowledge of HIV and sexual and reproductive health, HIV-related myths and misconceptions, cultural beliefs and practices are hindrances towards fighting the spread of HIV among men in high-risk settings.
We mobilize men in high risk. They are taught so many things. They like HIV prevention, how they should handle themselves, the importance of going to the hospital even if they're not sick to check if they have any problem. Then again, we're also telling them the new drugs that are available, that is PrEP, how they are being used, and how that can help them so that they can have a healthy life. Again, they also taught about GBV. In case they have a problem in their homes, where they should report, and how that is important in their life, so that they can live happily in their houses.
To improve their living standards, improve trust and love between lovers, as well as prevent the spread of HIV infections among heterosexual discordant couples, CMMB's IBAN-K intervention continues to make a positive impact on the lives of discordant couples.
We have implemented the IBAN-K program in Migori County since July 2022. And from that time to date, we have been able to reach slightly over 5,000 discordant couples within Migori County. Through the IBAN classes, most of the couples have been able to express that the kind of stigma they had, the kind of fear they had around embracing each other as, coming out openly and embracing each other irrespective of their HIV status, the fear has gone out.
Our peer educators have inspired couples to seek medical intervention as well as provided psychosocial support through support groups.
I'm a peer educator to the discordant couples. I follow up 68 peers, that is 34 couples. Each time I have an activity to conduct, I have to mobilize them to receive the biomedical services that they require. Number 2, I educate them on HIV risk and prevention of HIV and AIDS. Number 3, we do referrals. Each time we have an activity that is outreach, we refer those who need services.
It must be said that there is a link between sexual gender-based violence and HIV. Gender-based violence increases women's and adolescents' risk of acquiring HIV. It is because of this that CMMB, through our HIV program, is intervening to help end sexual and gender-based violence. By collaborating with community paralegals, women and adolescents are taught about their rights as well as assisted to seek justice.
I'm George Ojalo Muhaya, a community paralegal within Ugunja sub-county. The most prevalent GBV around my jurisdiction is wife beating, wife denial on property, mainly to those that their husbands have died, widows. As a paralegal, I create awareness on community members on their legal and human rights.
Our HIV program aims to reduce new HIV infections by 75%, reduce AIDS-related mortality by 50%, HIV-related stigma and prejudice to under 25%.
With this support and the contribution of CMMB, the annual HIV infections have come down from as high as above 10,000 per year to as low as below 2,000. Deaths also have come down from as high as 4,000 per year to as low as below 1,000 per year. And if you look at the prevalence, 10 years ago, the prevalence of SIA was as high as 26%, 24 to 26%. And currently, that prevalence actually has been halved. Currently, we are at 13.2%. And lastly, the notable achievement, which I'm going to say, is with respect to prevention of mother-to-child transmission. Siaya currently is the only county which is able to achieve the WHO cutoff of below 5%. Currently, Siaya is at 4.3%. It's the only county with that achievement. No child should be born positive.
For the past 12 years, CMMB, in collaboration with Migori and Siaya counties, with support from the Global Fund through Kenya Red Cross, has been intervening to help reduce the spread of HIV infections among adolescents, pregnant and lactating mothers, and men in high-risk settings and discordant couples. By educating communities, supporting treatment adherence, and addressing stigma, we can accelerate progress to ending HIV in Siaya and Migori counties. Join us in our mission to empower adolescents, women, and men living with HIV. Advocate and educate to help create a future free from HIV. Together, we can make a difference.